So welcome back, guys. We have another person that's going to be sharing the knowledge on this disease. Hi, Dr. Meach. How are you today?
Good. How are you?
Good. Can you come with me and talk about this? So, Dr. Meach, how effective is this vaccine?
So as Gene and Ben mentioned earlier,
Right.
it's fairly effective. It's probably the most effective method to prevent the disease, but it's not actually 100% effective. For example, if pertussis circulates the community, there's still a chance that a fully vaccinated person, regardless of their age or gender, can still catch the disease, which will eventually lead to whooping cough.
Oh, pretty interesting to know. How many different types of vaccines are available?
If we're talking about Canada specifically, there's actually 9 that are registered.
Oh, okay.
So there's quite a few options available.
Wow. So, Dr. Meach, could you describe this vaccine and when you get vaccinated?
Yeah, so when you get vaccinated, it's actually 0.5 milliliters, so it's not that much that's being injected into your body.
Right.
It's administered intramuscularly, like a lot of other vaccines. No vaccines are actually solely for pertussis. They're all a combination vaccine and contain other antigens for diseases like polio and diphtheria.
Wow. Okay.
Vaccination can start as early as 2 months of age, and you have them again at 4 months, 6 months, and 1 to 2 years.
Cool.
So it's quite the process, and after this, when kids start school, you have a booster shot between 4 and 6 years of age, and again at 14 and 16 years of age. Vaccines that have higher concentrations of the antigen are usually used for infants and young children less than 7 years of age. And this can also be used as a booster shot to children's 4 years to less than 7 years as well. Vaccines containing lower concentrations may also be administered as a boosted dose to children 4 years to less than 7 years of age and are the recommended product for older children, adolescents, and adults. If adults 18 plus have never been vaccinated for this before, they should receive 1 dose of what we call Boostrix. It's also known as Tdap. This is just because it contains lower doses of diphtheria toxoid, and especially if they plan on being in contact with children, it'll help prevent from spreading the disease. It is shown to be safe actually administering the vaccine to both pregnant and breastfeeding women, and basically anybody that is new to Canada or who works in like a health setting, they should all receive the vaccine if they've never had it before.
Wow, that's pretty good to know. I'd also like to know how long does the vaccination last?
It depends. Basically, the vaccine efficacy following the primary series is estimated to be about 85% to approximately 90% following booster immunization.
Okay.
Although the duration of protection offered by the vaccine is actually unknown, so it kind of ranges depending on the person.
Right.
Data or research suggests that protection doesn't really decline between the first booster shot, so that's 18 months, and the second booster, which is 4 to 6 years, so you're kind of guaranteed that period. However, after that, progressive decline is observed within the vaccination.
It's pretty good to know. Well, thanks a lot for sharing your knowledge, Dr. Meach.
Thanks for having me.
So guys, we're going to be heading for a break right now, and then we're going to be right back. So welcome back to the show, viewers. Now I have two other doctors with me who are going to be sharing knowledge on this disease. Dr. Sherwood, how are you? And Dr. B, how are you?
Good, how are you?
Good. You guys come over. So I'm going to be starting with you, Dr. Bealey. I'd like to know what the complications of this disease is.
Well, I'm glad you asked, Oshi. Many complications may arise from pertussis
Right.
if the vaccine is not received. For examples, infants under 6 months old, complications such as pneumonia, slowed breathing, weight loss, seizures, brain damage, and ultimately end up fatal. Some percentages found show that around 61% of the infants will have apnea, 23% of them will get pneumonia, 1.1% will get seizures,
Right.
and 1% will unfortunately result in death.
Wow.
Complications that may arise in older individuals, such as teens or just adults in general, are cracked ribs or bruised, hernias, and broken blood vessels. Another common complication is usually associated with weight loss.
Wow, pretty interesting facts. Thanks for sharing that, Dr. Bill. And Dr. Sherwood, I'd like you to share with us how would you manage this disease?
So the earlier an individual begins the treatment of pertussis, the better. If
Right.
treatment starts during the first 1 to 2 weeks before coughing and surgency happens, symptoms may be reduced. Clinicians should consider treating in advance while waiting for results, especially if dealing with infants. If a patient is diagnosed late, antibiotics will not alter the course of the illness. Administer the antibiotics to close contacts within 3 weeks of exposure, especially in high-risk settings. Choice of antimicrobial should be made after consideration of factors such as tolerability, potential for adverse events, drug interactions, ease of adherence, and cost. For infants, erythromycin, clarithromycin, and azithromycin are preferred for the treatment of pertussis in persons 1 month of age and older.
Right.
For infants 1 month of age, azithromycin are preferred for post-exposure prophylaxis and treatment. For 2 months of age and older, alternative treatment can be trimethylprim sulfame thiooxazole, and it is important to note that although azithromycin is recommended drug for the treatment of pertussis, precaution must be taken with those who have cardiovascular disease.
So, Dr. Sherwood, do you have any strategies for controlling disease? And for instance, how will you minimize the transmission of the disease?
First of all, it is important to get as much rest as possible and to follow the schedule for giving antibiotics exactly as prescribed by the doctor.
Okay.
You want to make sure that the home is kept free from irritants such as smoke, dust, dirt, and chemical fumes,
Right.
because they trigger coughing. Practice good hand washing and keep surfaces clean. And use a clean, cool vaporizer to help loosen mucus and soothe coughing. Encourage patient to consume lots of fluids such as water, juices, soups, and fruits so as to avoid dehydration, and small meals every few hours to avoid throwing up.
Wow, pretty good thoughts on that. Thank you very much, Billy, and thank you very much, Sherwood. Thank you guys. I will talk to you guys later. Thanks guys for taking your time to listen to us, and I hope you have a great day.